Welcome to our next episode of PPIE in Practice, where we share snapshots of public involvement and engagement activity happening across the School for Primary Care Research. Joining us today is Jo Burgin, who's an honorary researcher based at the Centre for Academic Primary Care at University of Bristol. Jo, thank you so much for speaking with me. Just to get us started, could you tell us a little bit more about your research area and the project that you've been doing and what it's aimed to find out?
Yeah, thank you, Hallie. So I wanted to do a project looking at the genitourinary syndrome of menopause, which is really under-researched and area with a lot of poor awareness even among the general public. So symptoms that are due to low estrogen that affect the vagina, the vulva, and the urinary system, and they can cause a range of symptoms: vaginal dryness, pain during sex, recurrent urinary tract infections, and just frequent urination. So it actually affects a huge proportion of women, we think, but it's something that is generally understudied, and probably because of the stigma, not only towards women's health issues like menopause, but also because of it being a sensitive area. So it's something that we wanted to look into a little bit more, and I wanted to find out if there were any inequalities there, any differences between different groups, and any specific barriers that women come across, and if there were, how would be best to go about researching that, how would be best to go about speaking to women about that and finding out a little bit more about how we could move forward with research in this area. Is it important to different groups of women? Is it something they want to be researched as a priority for them?
I wonder if you could share a little bit more about the key people or groups that you worked with and how you were able to involve them throughout the project.
Well, in terms of this project, I worked with the South Asian and Afro-Caribbean communities in Eastern. I had already established a relationship with these communities through my previous PPIE work on menopause. So myself and another academic clinical fellow had wanted to find out more about people's general awareness of the menopause, and we had done some work through the Elizabeth Blackwell Institute, got some funding to go into different community groups and give kind of a two-way presentation. So what we wanted to do is give people awareness as we were doing it. We wanted the PPIE to kind of do something at the same time as getting some information back. So we did a bit of a presentation about different menopause symptoms, and then got people to tell us what they knew about the menopause. And from that, we had put together these community leaflets that we had got feedback on, and those were kind of now available to use throughout our kind of local area. They're on our primary care network resources site, so that doctors can use them as well. So we had already built up a good relationship within these communities, and one of the best relationships that we had was through the health ambassadors that work with AFI Health, who have lots of really strong community links and had people who are dedicated to bringing research into communities. So I worked with a fantastic community health ambassador, Samina, and she helped me to advertise the group to her networks, and then we kind of worked together to run the group itself.
Sounds great that you've worked with such a range of people, and also that you were so focused on giving back to those that you were involving as well. I wonder if you could share a little bit more about, I guess, what you wanted to get out of involvement in your project, and I guess what insight you hoped these different groups and people would be able to bring.
So I suppose I knew that the area could be potentially sensitive because it was almost like a little bit of a don't ask, don't tell in the doctor's surgery. People tend not to bring up those symptoms, even if they are coming in about menopause, which is already stigmatized in and of itself. But when you do ask, people do tend to tell you. So actually, in the confines of a GP surgery, people can tell you what symptoms they have and they can be very open about it. So I knew that there were a lot of people who were suffering with these symptoms. And actually, through the literature, we know there are a huge percentage of people who report it on kind of anonymous surveys. So what I wanted to know is this a priority for different groups of people, or is it just felt to be, you know, this is not something that kind of crosses our minds. This is not of paramount importance to us, so kind of don't bother. But if it is important, then how do you want me to approach this research? What would be the best way to get the information that I need, and how could we do it in a sensitive way?
Yeah. I mean, what a huge like breadth of insight they could bring to kind of practical changes within clinical care as well. You've now finished the project, and I wonder if you've reflected a little bit on impact of those involved. And I guess when thinking about, I guess the impact that they may have had, um, has have they been able to influence maybe you personally, the project, or do you feel like there was any impact on those involved as well?
I think there was definitely an impact on people involved. People came up to me afterwards and thanked me for bringing the subject up. And it's for some people they had been suffering with it quite extensively, and that was one of the reasons they wanted to join the PPIE research. But for others, they had had symptoms, but it never they thought it was part of aging, and they didn't realize there was anything that they would ever be able to do to treat it. So there was some awareness raising for some people, and there was I suppose an opportunity to air some of the difficulties that other people had had as well. So I think that was a real opportunity within the group, and for everyone to realize, they're in this, we're in the same boat, and actually there is something that can be done about these symptoms, and just literally by telling people about it and telling people there was an option, something they felt that either they could take advantage of or they could tell people in their circles that they were close to about.
Amazing. I mean, you must have gained a huge amount of experience of involvement and engagement throughout all this work. Do you have any advice or maybe practical tips for others about kind of involving people and communities in research?
I think definitely establishing relationships over time is really important. So the fact that we were able to enter into a more kind of sensitive topic area was probably because we had started off looking at menopause in general. And so there was an element of trust there that we'd built up over time, that we weren't, I suppose, going to go in and just get information and then leave and never come back, and that there was something in it for the community as well. And that's definitely something I've taken from the work, is I love working in the community, and doing PPIE work is one of my favourite parts of research. There are things that I learned from this, um, kind of these focus groups almost. They're not focus groups, but they feel like when you're in a group and you're all talking, and the kind of the depth of information that you get back is really insightful and has such a massive impact on the project. We had, we had groups of um, a, a mixed group of South Asian women and Afro-Caribbean women, and they had very different experiences of interacting with the medical profession. And I got very different insights from both groups as to how this particular subject needed to be approached. That women from the Afro-Caribbean community, one woman said to me, my generation, she said, we're disgraceful. We'll talk about it. We don't mind talking about it. We're not embarrassed, but we really don't trust that the doctors have our best interests at heart. And so that's why we wouldn't approach them. Whereas women from the South Asian community were like, well, we trust what the doctor says, but we need to be with a female doctor. We need to be with someone that we feel that we're able to open up to. So actually, even though we had this mixed group, we when we went forward with the proposal, the group reflected that they would have almost preferred to be spoken to separately, so that we could have got more depth on the specific issues within the cultures that kind of affect how they interact with medical profession, and particularly with sensitive subjects like this.
I mean, that's really interesting learning for going forward, and it
Yeah.
leads me on to my next question and last question, actually, which is what do you plan to do next? And yeah, what happens after all of this?
So I've submitted a PhD proposal looking at diagnosis, management, and treatment of genitourinary syndrome. And that what I realized through this whole research is that it's this I wanted to focus on inequalities, and definitely this will run through inequity and making sure that the research we do highlights inequity where it exists, and any kind of recommendations or moving forward with thinking about interventions would need to have this, front of mind. But that actually really awareness, diagnosis, management of GSM for all women is very poor. So we're looking at doing a survey that collects data on what percentage of women in the UK are actually experiencing these symptoms, both the kind of the vaginal symptoms that we've typically asked about in the literature before, but also the urinary symptoms that have been less thought about. And as part of that, we're going to make sure we collect data on ethnicity, deprivation, age, the things that might stand in the way of women getting equitable care. Um, and then what we're going to do is, look at whether there's a difference between the number of women who are diagnosed and who are reporting symptoms and who's actually being diagnosed and treated, because I imagine there's a massive difference already in women who are suffering with the symptoms and women who actually get diagnosed and treated. But is that gap even wider for certain groups? And my hypothesis would be that it is, but I think it'd be really interesting to see if that's true and which groups would be most affected. And then finally, we'll speak to women in proper focus groups, and that's where some of this PPIE has really come back to help us, is in thinking about what the types of groups we would have, how we would run them, even the ability to do the focus groups, because we were asking people, would you feel comfortable talking about this in public, and in a group of 5 or 6 people, and actually people felt really comfortable as long as they were with women, from women from their own community especially. Once one person got talking, everyone got talking, so it gave us confidence to know that the kind of the proposal that we put forward would be effective.
I mean, it all sounds great, and I'm so glad to hear that the insight is going on to inform future work as well. So yeah, just to say a big thank you for chatting with me today, and best of luck with all the next steps.
Thanks, Hallie.